Why are we concerned about bone health in kids? Why is it important? So this chart basically emphasizes the importance of peak bone mass, achieving the peak bone mass. So what is it? So the higher the peak bone mass, that means the bone density of the kids, higher the chances of child having a healthy bones in the elderly age group. So basically, osteoporosis, which is a brittle bone disease, is a pediatric disorder. That means कि जो osteoporosis फ्रेजिलिटी फ्रैक्चर्स के जो रिस्क एडल्टहुड में होते हैं, एल्डरली में होते हैं, वो एक्चुअली प्रॉब्लम बचपन से शुरू हुई होती है क्योंकि उस टाइम पे न्यूट्रिशन प्रॉपर नहीं मिला होता है. सो अगर नॉर्मल सेक्यूरल ट्रेंड देखा जाए तो मोस्ट केसेस में पीक बोन मास वी ऑल अचीव बाय 25 to 30 ईयर्स ऑफ एज. इसलिए ज़रूरी है कि एनी एज kids of adolescent age group and pre-adolescent age group should have proper nutrition, exercise, body mass, body weight, so that they achieve a proper bone mass, and the ultimate strength of the bone is good. So that is how important is maintaining the good bone strength in the childhood. So if we see the normal growth velocity patterns, three main growth spurts are seen. That means इन 3 times पे बच्चे सबसे ज़्यादा ग्रो होते हैं. एक तो इंट्रा यूट्राइन, जब बच्चा पेट में है तो थर्ड ट्राइमेस्टर में सबसे ज़्यादा ग्रो करता है, सबसे फास्ट ग्रो करता है. सेकेंड स्पर्ट इज ड्यूरिंग इन्फेंसी, दैट मीन ड्यूरिंग द फर्स्ट ईयर ऑफ एज. Then the second and the third and the most important spurt is seen during the adolescent age group. लड़कियों में around 9 to 10 years of age, and लड़कों में around 20 to 13 years of age. And ज़्यादातर केसेस में ये देखा गया है कि once the girl achieves puberty, यानी कि जब उसके पीरियड स्टार्ट हो जाते हैं तो उसकी ऑलमोस्ट इट इज़ कंसिडर्ड दैट उसकी 90% ऑफ अल्टीमेट एडल्ट हाइट अचीव हो चुकी है. एंड सिमिलरली व्हेन अ बॉय ग्रोज हिज मुस्टैच एंड बियर्ड, so he has almost completed 99% of his the height growth. So उसके beyond height usually increase नहीं होती है. It's a minimal amount of growth in the height, and the child usually gain muscle mass, bone mass. ठीक है. So very commonly parents ask कि बच्चे की height कैसे बढ़ सकती है. तो बच्चे की एज से हाइट डिसाइड नहीं होती है, बच्चे की एज ऑफ प्यूबर्टी से हाइट डिसाइड होती है. सो जितना न्यूट्रिशनल ध्यान हम रखेंगे बच्चे के प्यूबर्टी के टाइम पे, उतनी ज़्यादा अल्टीमेट हाइट इंक्रीज होने की चांसेस हो, बिकॉज इट्स अ मल्टी फैक्टोरियल थिंग. इन्वायरमेंट का बहुत इंपॉर्टेंट रोल है, बच्चे के जेनेटिक्स का इंपॉर्टेंट रोल है, पेरेंट्स की हाइट कितनी थी, मदर फादर दोनों की हाइट कितनी थी, दैट अल्टीमेटली डिटरमिन्स कि बच्चे की हाइट क्या होगी. एंड समटाइम्स अंडरलाइंग हार्मोनल डिसऑर्डर्स के कारण हाइट बच्चे की कम रह जा सकती है, या बच्चा बहुत ज़्यादा हाइट भी गेन कर सकता है. सो दोनों ही एक्सट्रीम्स आर एबनॉर्मल एंड दीज नीड्स टू बी फॉलोड. सो व्हाट इज़ द बोन मेड अप ऑफ? बोन इज़ अ लाइव टिश्यू. जब भी बोन टूटती है बच्चों में या एडल्ट में तो बोन जुड़ती है. बच्चों में ये क्षमता बहुत ज़्यादा होती है. सो बेसिकली बोन्स दो पार्ट में डिवाइडेड होती है, द मैट्रिक्स पार्ट एंड द सेल्स पार्ट. तो मैट्रिक्स में यूजुअली एक मिनरल पार्ट होता है जिसमें कि कैल्शियम, फॉस्फेट, मैग्नीशियम, इनका कॉम्बिनेशन होता है हाइड्रोक्सीएपेटाइट क्रिस्टल के फॉर्म में. Then there is a protein part which is the type 1 collagen, which forms the organic part. Then there is around 10% of water as well in the bones. Now कुछ cells होते हैं, there is a cells part in the bones जो कि continuous body bones को resorb and new bone बनाते रहते हैं. तो proper bone cycle is again maintained by these cells जो कि bone खाते भी हैं and bone deposit भी करते हैं. So it's a dynamic process. The bone is a living structure. Whenever it breaks, it unites because it has that the live, it has vessels in it, blood flow in it, there are nerves within the bone, there is a lining on the bone which is called the periosteum जो बच्चों में बहुत मजबूत होती है. So that makes it a very dynamic structure. Now there are few things, 3 or 4 fundamental things which we can do to improve the bone health in the kids. And the most important thing is to maintain proper calcium levels in the body with proper diet supplements and natural sources of calcium. Then adequate amount of vitamin D, especially from the sunlight, because that is the only natural and the most abundant source of vitamin D. Then a lot of exercises, we'll talk about that. Then freedom from all kinds of addictions, especially smoking, alcohol. Parental smoking again is very common and detrimental to the child's health. Then lifestyle plays very important role. Sedentary lifestyle increases body weight, causes childhood obesity, and that decreases the ultimate bone mass. And identification of risk factors. If the child is on medications, have some genetic disorders, और इज़ प्रोन टू रिकरेंट फ्रैक्चर्स. सो ये सारी चीज़ों का आइडेंटिफिकेशन बहुत ज़रूरी है कि बच्चे को कोई और प्रॉब्लम तो नहीं है जिसके कारण वो कैल्शियम या विटामिन डी एब्जॉर्ब नहीं कर पा रहा है, मेल एब्जॉर्प्शन तो नहीं है. ये सारी चीज़ें बहुत इंपॉर्टेंट है. So if you talk about calcium, these are the common sources of calcium. Basically, all rainbow-colored fruits and vegetables have a lot of calcium in them. We all know all milk products will have abundant calcium. All green leafy vegetables need to be considered for calcium sources. Then all fruits, all kinds of fruits, most of them they have a lot of calcium. So all of them needs to be incorporated in the various forms. Either, ensure that they are not deeply fried. That is very important. Stir fried vegetables are very good. You can consider boiling them and stuffing in parathas if the child is not eating them on a regular basis. Making, incorporating in them in salad forms, or even, a broccoli just stir fried and then using with a curd dip. So all that are different ways you can use to incorporate calcium in the, diet of the kids, especially those who are fussy about it. Now, how to choose the dairy products? So there is some dairy dilemma. Less than 6 months of age, babies may always exclusive breastfeeding. Uske beyond, you can consider adding infant formula milk apart from breast milk. 1 साल से बड़े बच्चों में you can add cow's milk if the child tolerates it, and additionally one portion can be an infant formula milk. And 2 to 3 years तक यही पैटर्न कंटिन्यू रखना चाहिए. देयर आफ्टर यू कैन कंसिडर एडिंग बफलो मिल्क अगर चाइल्ड टॉलरेट करता है तो. बफलो मिल्क हैज़ हायर calorie content, that means more fatty, but it also has higher calcium and iron levels. But of course, all dairy products are usually deficient in iron, and you can consider adding other supplements, other health tonics to make up for that loss of lack of iron. We talk about vitamin D. Vitamin D, as we all know, is the sunshine vitamin. There are many factors which determines adequate vitamin D levels in the body. Now, the most important factor is कि आप किस time पे sunlight का exposure हो रहा है. So, the more vertical the sun rays are, that is between 10 a.m. to 3 p.m., the more ultraviolet B rays are there, and you're more likely to form more of vitamin D within the skin. This vitamin D synthesized in the skin. Now, अगर बच्चा बहुत dark है, वीटिश है, सो उनको यूजुअली ग्रेटर एक्सपोजर चाहिए होता है. नॉर्मल रिकमेंडेशन इज बिटवीन 10 to 15 minutes फॉर अ फेयर चाइल्ड. दीज आर वेस्टर्न रिकमेंडेशंस, बट अगर हम डार्क हैं एज एशियंस, सो हमें उसका अराउंड 2 to 3 times देना पड़ता है. अगर 30 minutes पे अगर बच्चा सनलाइट में खेल रहा है स्लीवलेस टॉप में या बेयर चेस्ट में, so they'll get good amount of vitamin D, around 10 to 20,000 of international units if they play around 20-25 minutes a day. So skin color is important, time of day they're playing is important. आपका shadow आपके body से लंबा नहीं होना चाहिए. That is the time, that means vitamin ultraviolet B rays are not sufficient and you will not form adequate vitamin D in the body. लेकिन सनलाइट का एक्सपोजर ये नहीं है कि स्किन बर्न्स होनी चाहिए, रेडनेस स्किन पे नहीं आनी चाहिए. बच्चा जितनी देर टॉलरेट करे उतनी ही देर बच्चों को धूप में रखें. ओवर एक्सपोजर इज ऑल्सो नॉट गुड बिकॉज दे हैव देयर ओन डेट्रीमेंटल इफेक्ट्स, कैन लीड टू सनबर्न्स, कैन ऑल्सो कॉज लॉन्ग टर्म एक्सपोजर्स कैन कॉज इवन स्किन कैंसर्स, राइट. सो दैट इज हाउ इम्पॉर्टेंट. पर अगर आप कार में ट्रैवल कर रहे हो, इफ़ यू हैव विंडो पेन्स, that cuts off the ultraviolet B rays. So direct exposure to sunlight is very important. अगर बच्चे ने sunscreen लगा रखा है, again that cuts off the vitamin D. Cold season में, cold countries में, as we go farther away from the equator, the rays become more and more slanting. The zenith angle keeps on decreasing, and the amount of ultraviolet B availability decreases. So you understand how to expose your child to vitamin D. Because this is the most abundant source and is very important to maintain calcium levels in the body. So there are some role of exercises. Exercises play a very important role. So if you see here, there are various kinds of exercises. Now, they can be cardio exercises that involves a lot of running. No, cardio means that will be a lot of swimming, cycling, all kinds of work where the child is activities where the child is not actually jumping or not impacting on the bones. So they usually are more useful for the cardiovascular health, for the heart health of the child. To build the muscle mass, usually they need more of muscle strengthening exercises, as in push-ups and all. But for the bones as such, the higher the the impact during exercises, the better it is. So the recommended exercises for bone building are those exercises which put a lot of stress on the bones. That means running, jumping, all kinds of ball games, running, which involves running, basketball playing, football. So these have been shown to increase bone density. The more you load the bone, the more bone the body forms. That's the Wolff's law, right? So the more the child exercise, the lesser the weight will be, and lesser will be the incidence and the chances of childhood obesity. With the lockdown in place few months back, so all our kids were locked down. There are higher chances of increased screen time. So it's very important to take care of the screen time, of what the child is eating, how much of junk the child is eating. Controlling the calorie content is all very important to control childhood obesity, because we all know it leads to multiple problems later on in adulthood. Diabetes is a very important risk factor in childhood, in obese kids. Hyperlipidemia, snoring in kids, hypertension, osteoarthritis, multiple bone and joint problems, developmental disorders of the hip and the joints are very common in these kids. Deformities, bowing of legs, is again very important. Is a very important symptom and problem in obese kids. मोटे बच्चों में ये problems होती हैं. And do not consider all obese kids to be because of genetic problems कि parents मोटे थे तो बच्चों को भी मोटा होना ज़रूरी है. ऐसा नहीं है. This is because the parents have not been exercising enough. That means the genes are not running in the families. It's because no one runs in the family. That is why obesity is running in family. So it's important to cut down the screen time. Online classes these days are very popular. जितना minimize कर सकें screen time, that will be good. That will increase the physical activity. Engage them in physical games, high impact game. The parents ideally should be involved with them. And jitna recommendations from American Academy of Pediatricians says it should be less than 2 hours in less than 2 years kids. There should be no screen time. Less than 3 to 4 years of age, around 1 year of 1 to 2 hours of screen time, and thereafter whatever you find is appropriate for the kid. And the content again needs to be monitored by the parents. So what we are talking about is the digital detox. So how do we diagnose कि बच्चों में bones की problem है? If the child complains of fatigue, letharginess, बच्चे में थकावट जल्दी हो जा रही है, बच्चे के पैरों में टेढ़ापन आ रहा है, चलने में लिम्प आना शुरू हो गया है, या बच्चे के पैर में दर्द बहुत ज़्यादा बता रहे हैं, साथ में चलने में भी परेशानी हो रही है, अगर वो हाइट गेन प्रॉपरली नहीं कर रहा है, इट इज़ इम्पॉर्टेंट टू गेट देम असेस्ड. लगातार दर्द पैरों में बताना इज़ ऑल्सो नॉट कॉमन अगर वो बहुत सीवियर है एंड वो परसिस्टेंट है. बच्चों में बार बार फ्रैक्चर्स हो सकता है, बोनी बम्प्स आपको फील हो सकती है, विच में बी अ साइन ऑफ rickets in the kids. They may also have dental problems. They can have backaches. So all these are indications कि underlying bone problems हैं बच्चों में. So it's very important to incorporate few of the 5210. This formula can be incorporated in the lifestyle of the kids. 5 or more fruits or vegetables in the kids. 2 hours or less, if possible, of screen time. 1 hour or more of physical activity, and 0 sugary drinks, and more of water, and less of fatty products and junk food. So another very important thing is addictions. So बच्चों में क्या होता है कि they are somehow attracted to soft drinks, lot of soft drinks. What soft drinks does is firstly they are very rich in calories, they have very high sugar content, then they also have high levels of acidic components in it, like phosphoric acid and citric acid. When the child takes them on a regular basis, what it does is increases the acidity in our blood, decreases the pH. Now what calcium does is neutralizes the acid, and the calcium gradually leaches out of bone. So जितना हो सके carbonated drinks avoid करना चाहिए whenever possible. 70 to 80% of food आपको ऐसा रखना चाहिए which includes around 50% of fruits and vegetables, a quarter of grains, whole grains, and a quarter of proteins, all animal and plant proteins, and a dairy. This should be an ideal platter for the kids. And sometimes 10 to 20% of diet can be kept as a cheat diet. Sometimes when you can feed occasional fried items and junk food, but that should be kept at minimum. wherever possible. That should not be a complete meal in itself, right? So that is how you take care of your the bone health in kids. Identification of hormonal disorders again is very important. ज़रूरी है कि टाइम से जब भी आपको लगे कि बच्चे में कोई प्रॉब्लम हो रही है, बच्चा ग्रो नहीं कर रहा है, प्यूबर्टी बहुत जल्दी आ गई है, तो these are red flags जिसमें कि we might need to intervene and identify and underline endocrine disorders. So then again, that is also very important. So we have talked about calcium, we have talked about vitamin D, we have talked about exercises, we have talked about the lifestyle, how to maintain body mass index, we have talked about supplements, hormonal disorders. So it's important कि इन सारी चीज़ों का ध्यान रखा जाए and to diagnose any of these bone and joint problems timely. So that is how we can build healthy adults with strong bones and prevent long-term problems because of osteoporosis and fragility factors.